Another full mouth case today. The unique thing about this case is, apart from a conventional implants, what we're gonna put two pterygoid implants. So this video is to mainly talk about these implants, which are called pterygoid implants. So this is a full mouth case where whole mouth extraction, lot of teeth which are present. We're gonna extract these teeth. We're gonna put total 12 implants, 6 in the lower jaw, 4 in the front, which are the conventional normal implants which we put. This is an immediate extraction placement case. The unique thing about this case is, show here, these two implants are going behind the jaw. So pterygoid implants are implants which are fixed into pterygoid bone, the bone which is behind your normal jaw. Why these implants are required? These implants are required when this area here is called maxillary sinus. So if we cannot put an implant in this area, so that we can give you a molars with implant supported prosthesis, that is a full mouth prosthesis, full mouth fixed teeth, what we do is we tilt your implant behind the jaw and engage a bone which is just behind your jaw, which is called pterygoid plates. This requires little skill, this requires little speciality. Oral and maxillofacial surgeons are the one, and obviously another the implantologists who are senior implantologists who are trained to put these implants. They are the one who practices this implant. The benefit of this implant is, if I just put 4 implants, I cannot take my prosthesis too much behind. I may not be able to give first molar or second molar into the full mouth set. What happens is then the fewer teeth will have a fewer biting efficiency. Another problem is when the 4 teeth are placed, some of the teeth are hanging behind there, called cantilever. This cantilever is detrimental for long-term health of the prosthesis, where the screws are going to loosen up because the pressure is behind on the hanging teeth. The load comes onto the last implant which is there, and the screw which is holding this prosthesis into that area. So we are prepared for the implants today. We have bone graft which have been prepared for the case. So we're going to be extracting the teeth, placing conventional implant, some of the pterygoid implants, and we may finish the case today completely. We can give immediate temporary prosthesis also in the evening if it has been planned. Today's case, the patient is hemiplegic, and we may not be able to continue the surgery for longer time. So, and patient is not willing to take a temporary denture. So we are not going for a temporary denture or temporary prosthesis today, but with 12 implants, pterygoid implants. So pterygoid implants gives a benefit of a very strong anchorage, a very strong initial fixation. So the benefit of putting pterygoid implant along with other implants is we can give immediate temporary prosthesis, immediate fixed dentures in the evening of the surgery, which is useful, which is functional, and patient is not without the teeth for the period of this healing, which is 2 to 3 months. After that, we're going to give a fixed denture. Apart from the pterygoid implants, another implants which we use for these kind of situation where there's a lot of bone which is not available in the back of the jaw is called zygomatic implants. The 2 long implants we use into a zygomatic bone, this cheekbone, and extend into the jaw and then fix it. So this is called the anchorage which is away from the jaw. And these kind of implants, which are pterygoid and zygomatic implants, are the specialized implant used by a senior implantologist and mainly oral and maxillofacial surgeons. This avoid lot of bone grafting procedures. This avoid a long-term wait for the patient. This, with such a kind of bone loss, with adding pterygoid implants and zygomatic implants, we can give immediate dentures on the same day, and a final prosthesis is in the same time as a conventional implant with lot of bone. So we'll be starting the case, and we'll try to finish everything today. We're prepared. We're prepared for the surgery. The surgical setup is done. My assistant, they help me do all the surgical setup. Surgical setup is done. Patient is waiting. We'll take the patient now and start the surgery. Thank you.